You're watching Good Morning Britain. Now, Labour is pledging to cut waiting times for GP appointments, train an extra 7,500 doctors and 10,000 nurses a year if it gets into government.
But in a speech today, Shadow Health Secretary Wes Streeting will say it's not just money that'll fix the NHS. We're joined now by Wes Streeting from Westminster. Wes Streeting, thanks for joining us this morning on Good Morning Britain.
Good morning.
So you say, let's talk about GP appointments. Let's talk about that first of all. You say that 5 million people a month are waiting for 2 weeks to get a GP appointment. I mean, I'm sure, you know, lots of GPs, lots of people would like that to be shortened, but how are you going to change that?
I'm glad you mentioned GPs. There simply aren't enough of them, and the ones that we do have, despite their very best efforts to try and meet demand and to make more appointments available, they're just overwhelmed by the number of people seeking to get an appointment. And you know, we've lost 2,000 doctors in recent years. Unless we increase the number of doctors, keep the great doctors that we already have, we're going to struggle to see patients seen on time. And the reason I make the argument about reform today is that one of the areas where I think we can help GPs and help patients is providing a wider range of services in the community to help patients get seen faster and also reduce demand on overstretched GPs at the same time as we are training a new generation of doctors by doubling the number of medical school places. So Labour has got a track record on this, remember. When we were in government, we delivered the shortest waiting times and the highest patient satisfaction in history. We can do it again, but it will require us to invest in the workforce and also to change the way that neighbourhood services are delivered so that patients have more choice and doctors and GPs in particular don't become the bottleneck of patients trying to access the NHS.
I'm not sure there's many people would disagree with everything you said there. I think it all sounds in principle great. Training new doctors takes years, though. The crisis is now. And secondly, there are GPs that are uncomfortable about some of those reforms, aren't there? Saying that their recommendations, they have to be the cornerstone. So by farming out, which is a principle, and you've argued for in terms of that reform of the GP practice, actually decreases what they can achieve.
Well, firstly, let me say I think GPs have got a crucial role to play, and under a Labour government will have an even more important role to play, because I want to make sure that we are investing more in primary care, more at the front door of the NHS, so that we can do faster diagnosis for patients, which means both more effective treatment, better outcomes for patients, but it's also less expensive for the taxpayer, because the average GP appointment costs about 40 quid to provide. If someone walks into A&E because they can't get a GP appointment, that can cost around £360. So there's a value for money argument here as well. In terms of what we're proposing, something like Labour's community mental health hubs, for example, a fully costed, fully funded policy, would give patients faster access to mental health services, but it would reduce pressure on GPs at the same time, because one of the things that GPs tell me is that they are having increasing numbers of mental health cases present in their surgeries because mental health services more widely are stretched. So I think this can be win-win. We can't do this without GPs, that's why we need more of them. But you're right, Kate, in the meantime we need to think about how we can widen the range of services available to patients.
Mrs. Reid, as Kate says, a lot of what you said there sounds very reasonable, and I think a lot of people would agree with you. What feels really unreasonable for a lot of people, and even a lot of Labour supporters, is the sort of gutter politics that the Labour Party has become part of in the last couple of weeks. And I refer to the adverts that are popping up on social media and various other places from the Labour Party. It started with the one that accused Mr. Sunak. Here's the question was, do you think adults convicted of sexually assaulting children should go to prison? Today we see a latest one which talks about, do you think super rich deserve a tax loophole more than cancer patients deserve life-saving treatment? You've doubled down on these. You think this is absolutely the right thing for the Labour Party to do. It seems pretty dirty. It seems really personal, and a lot of people feel very uncomfortable with what's happening at the moment.
Well, I make no apology for holding the Conservatives to account for their record of 13 years in government, but also the choices they continue to make. One of the ways we're going to be able to deliver the biggest expansion of NHS staff in history is by abolishing the non-dom tax loophole that benefits the very wealthy. And by doing that, we raise more than £3 billion, which enables us to both increase the number of NHS staff through the biggest expansion in history and provide free primary school breakfast clubs in every school so that children start the day with hungry minds, not hungry bellies. And I think those are fair choices, but Rishi Sunak opposes them.
But just on the ads themselves, let's look at that first one. And you were asked about this on the weekend, just gone. Do you think adults convicted of sexually assaulting children should go to prison? Rishi Sunak doesn't. Is the poster with his signature there. You were asked this on the weekend and you said, yes, I have to assume that he thinks that. Do you really, be honest, people are watching at home right now, Wes Streeting, do you honestly think the Prime Minister of this country thinks that adults convicted of sexually assaulted children shouldn't go to prison?
Well, ask him, because he's got to explain otherwise. If he doesn't believe that, why does he allow 4,500 people who are convicted of sexually assaulting children to walk free?
But that's the question to ask, though, isn't it? That is the question to ask, Mr. Streeting, not to put out posters which are really misleading and quite personal. That's the question you'd ask Mr. Sunak.
Aren't we? But we're having that debate now, aren't we? We're finally holding the Conservatives to account for their record. And that's the purpose of these ads, is to spark debate, to have accountability for the government. 98% of rapists don't even see the inside of a courtroom, let alone a prison cell. I think we should be more offended about that rather than whether we're being mean to Mr. Sunak.
Let's take, for example, the NHS strikes. You can't decide what the nurses should be paid, what junior doctors could be paid. Could the Tories put out a poster today saying Wes Streeting cares more about bashing Rishi Sunak than he does about the nurses?
But you're saying this as if the Tories aren't already doing that. You should see the attack ads with Keir Starmer's face on. I know people don't always like...
Why have you entered that kind of politics, then? Are you happy to sort of stoop to their level, if that's what you're accusing them of?
Look, we'll go into the next election fighting on Labour's policies for the future that we think will be able to make a really big difference. But I'm afraid, and I know they're not everyone's cup of tea, but attack ads have always had a place in politics to hold people to account for their record, particularly when they've got a record as bad as this government's. And not everyone's going to like them, but I tell you what, they got shared more than... Maybe this is where your viewers can help me out. You can share all of my positive social media graphics about the biggest expansion of the NHS workforce in history and prove that positive campaigning gets more attention, more coverage than negative campaigning. But that ad you showed has been shown more times than I think any other Labour ad in history, I suspect, at this stage. And I know that attack ads aren't everyone's cup of tea, but they do have a place in politics in terms of holding people to account for their record.
OK, so they're effective. The trouble with that is, while you are taking a position as a party that you're the good party and the Conservatives are the sleazy, ineffective party, then by admitting that you need these ads, you're sort of saying, can't beat them, join them, aren't you? And that creates a bigger image that becomes problematic, I would say. It's hard for you to say we're good and they're not if you've joined something that you know people find very uncomfortable.
Well, I think we've got records to compare now, 13 years of Conservative government versus the last 13 years of Labour government. And people can compare and contrast the shortest waiting times and the highest patient satisfaction in history in the NHS. We were tough on crime and tough on the causes of crime, and that was reflected in neighbourhood policing, which the Tories cut. And as for the economy and the cost of living, I mean, we didn't see anything like what's going on now in terms of inflation and people's mortgages soaring. So people can compare and contrast. I will continue to campaign proudly on Labour's record and Labour's positive ideas for the future. We've got to hold the Tories to account, though.
So let me hold you to account, if I may, because, you know, these sort of ads get the debate going and then we need to deal with the detail. That's our job to do, isn't it? So what do you think is the right amount to pay the nurses? RCN have rejected one offer. You have said 90%, their original request was too much. What do you think the correct amount is?
Well, if I were the Health Secretary today, I wouldn't be negotiating live on air and going into the negotiations with a public figure. That wouldn't be a sensible way to enter the negotiations. But we've said throughout the government should negotiate. And just to be clear on this, there are a couple of nursing unions and unions that represent other healthcare workers that are out balloting on that deal at the moment. I think we've got to give them the time and space to do that. But on the junior doctors dispute, the talks haven't even started. And I think that's crackers, because yesterday the doctors said they're willing to negotiate down on 35%. There are no preconditions for them on talks. They're willing to negotiate any time. And the third thing they said is they haven't actually announced any more strike dates yet. So there's a golden window of opportunity. And yet the government says, oh, we can't negotiate because of these preconditions, the 35%, and they've got to call off the strikes. I just think the government is gaslighting doctors now and missing the fact here that unless we get a settlement with the doctors, the risk isn't simply they walk out for another day of strike action, it's they walk out of the NHS altogether.
I mean, that leaves you open to an accusation and a tweet and a poster that says he promises everything, but he can't be specific about the detail. He says, elect me and I'll deliver, but I can't tell you what I would deliver. That leaves you open to that, doesn't it?
It's the opposite, Kate, which is we're not going to make promises unless we're 100% sure we can keep them. And our promise is that every policy in Labour's manifesto will be fully costed and fully funded. There are lots of things I would like to do that will take time. And I'd also say judge us on our record. You know, the last Labour government delivered full pay restoration for NHS staff and improved services. And we were able to do that because we grew the economy. And if the economy had grown under the last 13 years of Conservative government at the rate it did under the last Labour government, there'd be £40 billion more to spend on public services without having to increase anyone's taxes. So we've got a proud record to compare and contrast.
OK. Wes Keating,
pleasure.
Thank you for joining us, Shadow Secretary of State for Health and Social Care.